Welcome to the Midmark 1000 video resource. This video will first go through the components of the accessories box and then move into tips on taking care of your handpieces. We will finish up with maintenance. Let's get started.
I'd like to cover what comes with the purchase of the Midmark 1000. So obviously we provide a user guide right here. So this is a very nice handy manual to have in your practice. It goes through all the maintenance needed, all the parts and pieces of this equipment, and really it's important because when you take really good care of this system, it's going to last you a really long time. So you're going to get your user guide in here. We're also going to provide 3 scaling tips. So the one that we have on here is the routine scaling tip. This one can be used just for your general cleaning of your teeth. This is the one that most clinics use most commonly. And as a matter of fact, a lot of practices that we go into, sometimes this is the only one that they use, which that's not what we want you to do. We provide 3 because we want you to use these interchangeably. When you use these tips interchangeably for what they're made for, then your tips will last a lot longer. You'll be more efficient when you're doing your cleaning procedures. And we provide you this tip wear guide to measure the tips because they do wear down over time. So real important that you keep these things handy and accessible for every dentistry procedure. So we've got our routine scaling tip. Then we also provide what's called a beaver tail tip. This is a flat, wide tip, and what this is used for are those patients that have that really heavy calculus buildup on their teeth. We don't want you using tartar crackers anymore, so this flat, wide tip, when you touch this down onto some of that real heavy calculus, the power of this scaler is going to bust that calculus right off of the tooth. So when you have patients with that heavy stuff, we want you to use this. And then we also provide you a perio tip. This is the tip that you can use subgingivally in 3 to 4 millimeter pockets. So anything greater than a 3 millimeter pocket is considered significant. Now when we're working with feline patients and really tiny dogs, it's 1 millimeter. So anything over 3 millimeters, you're probably going to need to do some extra treatment for, but anything 3 to 4 millimeters, you can clean that pocket out really nice with this perio tip. We also provide you these tip wrenches, which will help you safely put on and remove your scaling tips. We don't want you over tightening, so we provide you 3 of these. You can put your tips right in them, set them on your scaling unit, and when you're doing your procedures, you can swap these out throughout the procedure as needed. And then we give you a burr starter kit. Now this is a starter kit. This isn't a kit that you should use over and over and over again. Sometimes we go into practices and we notice that these tips are really worn down. These tips, especially your crosscut fissures and your round burrs, really should be used one time and then discarded. So these are inexpensive, and when that cutting surface wears down, you inadvertently apply more pressure to cut the tooth, and what that can do is it can put too much pressure on the turbine of your high-speed handpiece and damage it. And so we provide you a variety of crosscut fissure burrs for sectioning, some round burrs, and then we give you, there's 2 burrs in here that you can reuse over and over and over again, and these are the diamond burrs. So this you can use when you're smoothing that bone out. So if you do an oral surgery procedure and you've got some jagged bone from where you remove some alveolar bone or some of those tooth roots, you can smooth that bone out with these diamond burrs, and you can reuse these over and over. We're also going to provide you a pack of disposable prophy angles. We're using the Crosstex here, and what these do, instead of going around and around, they oscillate like this, and so that means that it generates less heat, but also it's not going to splatter the blood and saliva around or catch the muzzle hair on your longer haired patients. So we give you a pack of these as well. Now, the conditioning spray is really important. We want you to have this handy. Anytime you do an oral procedure, it's really important that you condition that high-speed handpiece. What generally tends to happen from the bone particles and the graphite from the burr, they can get down into the gears of this handpiece and really kind of gunk it up a little bit. And so after every oral procedure, if you condition this handpiece, it'll get up into the gears of the head, it'll loosen all that debris up, and it flushes it right out of the handpiece. This is going to make your handpiece last longer. It's going to help get the burrs in and out efficiently and smoothly, and it's just really best practices for your high-speed handpiece. Now, our low-speed handpiece, you can also condition as well. Same thing on a regular basis, condition this handpiece and it'll last you a lot longer. I'd like to talk a little bit about handpiece care. I want to focus really on our high-speed handpiece as well as our scaler tips and our scaler specifically. So we know that handpieces don't last forever, but there are some things that we can do to ensure that they last us for as long as they possibly can. I'd like to start first with our scaler tips. Now, there's various different scaler tips out there that can be used when doing cleaning procedures, and they should all be used interchangeably. We provide 3, and we think that there could be procedures where you may need to use all 3 of these tips during one procedure. So the more you change these out and switch them for particular areas that they're made for, the longer these tips are going to last and the more effective they're going to be. And so we've got 3 tips. We have a routine scaling tip. This is what you're going to do most of your routine scaling and cleaning with. So you've got your routine tip here. We also provide a beaver tail tip, which is a flat wide tip. Now, how these are used is if you have a patient with that really heavy calculus buildup, generally we see it over these molars here in the back, but we don't want you using tartar crackers. We want you to use this beaver tail tip, and when you set the side of that tip down on that heavy calculus, it's going to split it right in half and it's going to come right off of the tooth. And so you can use that tip for the heavy calculus. And then the third tip that we provide is our perio tip. So this is the tip that can be used 3 to 4 millimeters in the pocket subgingivally. This is really important because anything above a 3 millimeter pocket is clinically significant. So when we're looking at feline patients and really small dogs, 1 millimeter is significant, but any other patient that's a 3 or above, that's really significant, and you're probably going to need to do some additional work. But 3 to 4 millimeters, you can safely get in there and really clean the debris on the tooth surface. So that perio tip is also really nice. Now, these do wear down, so depending on the technique of the user and the volume of dentistry that you do in your practice, these are going to wear down. And so it's important that you utilize this tip wear guide to help you understand if you're getting ready to need to replace your tip. So I do suggest that you measure these tips once a month and really keep track of when these get into the red zone. So it's got a green and a red, so it'll let you know when you need to replace these tips. I would like to talk about technique a little bit with all of our scaler tips. You never want to use the very tip of any of these tips directly on the tooth surface. That can be very painful for the patient. So where these tips work best is really on the side. That's where the vibration is the strongest. And so I hold my scaler just like I would a pen or a pencil. It's like a modified pen grip. And then I use that on the side to scale the teeth. You'll notice that it's much more efficient, it's very fast that way, and it's very safe. So all 3 of those tips, same thing. You never want to use the top of the tip directly on the tooth surface. So that's on our scaler.
There is a color-coded dial on the front of your Midmark 1000. You will notice on the bottom of the tips provided, there are blue rings around the bottom of the tips. This means when you are scaling, you want to keep the dial within the blue frequency range. This is the range where your tips will be the most efficient and the safest.
Now I'd like to talk about our high-speed handpiece. Technique is a big important thing when we're working with high-speed handpieces. So we talked about these burrs here. We've got cross-cut fissure burrs, round burrs, diamond burrs, these are all used in various different ways depending on who you've learned from. But what's really, really important to keep your turbines lasting as long as possible is not applying too much pressure when you're either cross-sectioning or removing bone. The other thing I want you to keep in mind too is that these need to be disposed of after every oral surgery procedure. So with exception of our diamond burrs, which are used to smooth bone, any round burr or crosscut fissure burr that you use after that procedure, you should really put these in the trash can and put a new burr onto your handpiece. So it's a lot less expensive to buy a pack of burrs and replace these after every oral procedure rather than replacing your turbines. These turbines can be expensive, so we want to remove them. So what happens when you reuse them is they can wear down. So when the cutting surfaces of these burrs wear down, you inadvertently apply too much pressure to cut through your bone, and then what happens is it just over time really wears down those turbines and you'll have to replace them. So one of the things that I want to go over too, now I'm not a veterinarian, but I just want to share this with you when you're doing your procedures. If you've got a cross-cut fissure burr on your high-speed handpiece, and maybe you're sectioning this upper fourth premolar, you want to separate all three of these roots out, what we don't want to do is take that cutting burr and drag down through the tooth. That also puts a lot of pressure on the top of that handpiece. How these burrs work best is to brush or paint down through the bone, and you don't have to use a lot of pressure. This rotates at 400,000 RPMs. It's got a lot of power. So think about that rotation and dragging that burr down. You can understand how that can put a lot of pressure on the top of that handpiece. So you want to paint down through. A light brushing technique is all you need when you're cross-sectioning a tooth. And when you have your round burrs on, if you're using those for sectioning, or maybe you're removing alveolar bone to expose a tooth root a little bit, then you really just want to skate across the pond with that. That's a term that Dr. Cindy Charlier uses a lot. It's just a very easy skating across that area that you want to remove. You're not using a lot of pressure on that either. So these things are really going to help keep those turbines in place and last as long as possible. Also, pitching those burrs after every use, conditioning your handpiece is really important as well. We know that a lot of graphite and bone particles can get up into the gears of this handpiece and it can gunk it up. And so it's really important that you condition your handpiece after every oral surgery procedure so you can break up all that debris in the handpiece and flush it right out of there. That's going to make the burrs easier to get in and out, and these are all things that are going to make your turbines and your tips last as long as they possibly can.
Handpiece and waterline maintenance is imperative to ensure your equipment lasts for years to come. First, let's go over how to condition your handpieces. You must place a burr in the high-speed handpiece prior to installing the conditioning spray. First, you will shake the spray can well before each use. You'll assemble the red spray tube into the spray can head. Insert the tube into the drive air of your 5-hole high-speed handpiece. Press the top button of the spray can and spray until the conditioner flows from both ends of the handpiece head. Then you will remove the handpiece and shake off excess conditioning spray. You will reattach the handpiece to the hose and run the handpiece at full speed for 60 seconds. Once you've completed this step, you can wipe off excess conditioner and your handpiece is ready to go. Waterline maintenance can be easy with Dentapure cartridges. Biofilm can build up inside the tubing of every delivery system. It is necessary to keep that bacteria count down to a minimum. Midmark recommends the Dentapure cartridge for each water bottle to ensure 365 days of continuous waterline disinfection. The cartridge installs easily to the 1000's existing water bottle pickup tube. Lastly, I'd like to provide you with important contact information in the event you need technical or clinical support. 1-800-Midmark is the first number you will call in the event you are experiencing technical problems with your delivery system. Follow the prompts to Animal Health Dental Delivery. Have your serial number handy so a member of our technical services department can pull up your account and document your concern. You have 2 clinical resources to reach out to with clinical or training questions. Linda Papalardo is our dental clinical manager, and Danielle Heberly is the manager of clinical services. We hope you found this video helpful and appreciate you trusting Midmark with your dental delivery system. Thank you.